Right, let's make a start. Good afternoon, everyone, and thank you so much for joining us today. So, this webinar is part of our Research to Real Life campaign, where we are showcasing the new research that the TSA is funding as part of our commitment to address the real unmet needs of people affected by TSC. I'd also like to thank everyone who has so far engaged with the campaign or supported us through donations. Your support genuinely makes this possible as it allows us to fund research that has the potential to make a meaningful difference to people's lives. Today's talk focuses on an area that we know so many families recognize as quite important to them, which is drug resistant epilepsy and the wider impact of TSC associated neuropsychiatric disorders or TAND. Even with current treatments, many people continue to experience seizures and ongoing challenges in their day to day life. Um, What's particularly interesting about this research is the focus on the blood brain barrier. Oh, need volume up. You see? Okay, I'll get closer. I don't know why volume is a problem. So, what's particularly interesting about the research is the focus on the blood brain barrier, exploring whether changes in how the brain protects itself might be one of the missing links in understanding seizures and TAN, and importantly, whether this opens up new ways to diagnose and treat them. So I'm really pleased to introduce Dr. Claire Behan, who will be sharing more about this work and what it could mean for the future of TSC research and care. So Claire, over to you.
Thanks, Pooja, and thank you to the TSA for having me today. It's really lovely to have the opportunity to talk a little bit about this project, which wouldn't have been possible without the support of all of the TSA community. So a big thanks from myself and the wider team. Um, uh, Dr. Chris Green, who is very much a large part of this project, was hoping to be with us today, but unfortunately is a little under the weather, so can't make it. But we do have Mary Basigi here with us again, who is a large part of this project, and hopefully we'll hear a little bit from Mary as well as the webinar goes on. So I suppose on that basis, I think I'd like to just introduce some of the wider teams. So I don't know if, can you see my cursor moving? Yeah, great. Okay, so this is Chris Green. He is a star lecturer in the Department of Physiology in RCSI and part of Future Neuro Research Centre. Chris did his PhD with Prof. Matt Campbell in Trinity College, and he started looking back then, well over a decade ago, at the blood-brain barrier, looking at different syndromes like 22q deletion syndrome and schizophrenia. And he then started in his postdoc work using neuroimaging to look at biomarkers for people with epilepsy, long COVID, concussion. So he is certainly well experienced in the area of blood-brain barrier. And his current work is looking at the blood-brain barrier, central nervous system, brain function in health and disease, and understanding why particular areas are vulnerable to disease. And you'll see why that's relevant when we go further into the webinar. Next to him is Mary Basigi, who really doesn't probably need any introduction in the area of TSC, but she has just finished her PhD under the supervision of Prof. Colin Doherty, and her work really built a huge data set in Ireland about understanding the situation here, and that was really missing up to that point. So she also sits on many patient committees. She is a member of TS Ireland, along with lots of other patient organizations, Ithaca. She is a member of Rare Disease Clinical Trials Ireland, and probably lots more since I've been talking to her recently. So Mary provides our real oversight in terms of our PPI, along with her very extensive knowledge of TSC, both personally and professionally. And next to her is Professor Colin Doherty. So Prof. Colin Doherty is a consultant neurologist. He's head of school of Trinity College Dublin. He has, again, a long history with TSC. He, as a trainee, worked with Elizabeth Thiel in Boston and developed a real keen interest in TSC and has probably one of the most prominent figures, again, in TSC in Ireland. And he began the TS service in St. James's Hospital, but also has decades of experience working with the blood-brain barrier in both epilepsy, concussion, and different areas. So again, we're kind of merging all this expertise under this project. Dr. or Professor Petrus de Vries, again, probably needs no introduction to this audience. He is a professor of child and adolescent psychiatry and the director of the Centre for Autism Research in Africa. And he has a long-standing clinical research program in tuberous sclerosis and TAND, or tuberous sclerosis associated neuropsychiatric disorders. And he was chairman of the panel, the neuropsychiatric panel, who coined the term TAND and lead author. Down here is Dr. Damien Ferguson. Damien is a consultant neurologist in St. James's Hospital, and he's lead of the TSC clinic there. Damien had research interest in cognitive neurology also, but he is very active clinically in TSC and one of our lead consultant neurologists in the area. Next to him is Anne Goff. Anne Goff is a registered advanced nurse practitioner in epilepsy, again, as part of the TSC clinic in St. James's Hospital. And these people are really the ones who are on the ground with this project and will really lead from the front when it comes to recruitment and driving this project forward. As will Isabel Hunt, who is next to her. She is a research fellow and working on the area of blood-brain barrier as part of her PhD under the supervision of Prof. Colin Doherty and Professor Matt Campbell, who's been mentioned a few times at this stage. And this is Prof. Matt Campbell, who is a professor in Trinity College and again has decades and decades of experience in researching the blood-brain barrier in lots of different clinical conditions, but also very importantly on a very molecular level. So they are the team who are working in the background on this project and really who, without whom this just wouldn't be possible. So although my name is on the application, these are the people working in the background who are absolutely pivotal to the success of the project. So I just thought, us being from across the water, it would be nice to give you an introduction into who we are and where your very important funding is going to. So I suppose let's get on to the project now and what exactly we're trying to do. So we know that tuberous sclerosis is a genetic condition. It causes these tumors or growths to grow in many organs around the body, including the brain. And we wonder, are these tumors the cause of many of the difficulties that people with TSC suffer? We know that it imposes a heavy burden, but some of those really important key mechanisms still remain unexplained. And the vast majority of people with TSC, about 80 to 90%, will develop epilepsy. And often this is very difficult to control epilepsy. And certainly in my clinical experience, which is over the last 10 years or more, has been in TSC. This is something we hear all of the time. This is something patients and their loved ones come to us with, complaining of very difficult to control seizures. It has a huge knock-on effect on lifestyle and that of both the person with TS and their family members. But then also we have this concurrent condition of tuberous sclerosis associated neuropsychiatric disorders, or TAND. And again, the majority of people with TS experiencing difficulties in this area. And one of the things that we wondered, and some of my PhD research looked at the blood-brain barrier, and when I combined some of that work with the clinical work that was happening, and really brought these two questions together about, well, what's happening in the blood-brain barrier of people with tuberous sclerosis complex. And is this a reason why we're seeing an increased level of drug-resistant epilepsy in this cohort of patients versus others? And is it connected to TAND and their experience of that? What's driving these issues? And can we make a connection to blood-brain barrier? So that really drove a conversation, like all good research projects. It started being developed over a cup of coffee with myself and Chris, really combining these two parts of something that I had been working on, the blood-brain barrier and TSC. And we kind of set together these a couple of questions about what exactly do we want to ask, and what can the research tell us. And when we looked to the research, really there's a massive gap in the research here. So our main questions are, does blood-brain barrier leakage occur specifically or near tubers that are driving seizures? We know that some tubers drive seizures, others don't. Does the degree of that leakage track with how severe a patient's epilepsy is or their neuropsychiatric difficulties are? And is the blood-brain barrier a consequence of the known molecular path for TSC, so that mTOR pathway that we know of, and could potentially it be reversed or treated? And that's really important, because I suppose that particular last point, is there something that can potentially be done that will meet the treatment needs that are not there yet for people with TSC? And that's really what drives, I suppose, everything that we do when it comes to research. So again, why do some brain areas in TSC cause seizures while others do not, and what can we potentially do about it? So that's really the central question to what we're asking in this research. So I suppose before we go any further, I just wanted to give some background information on the blood-brain barrier, since that's really what we're focusing on at the moment. So this is kind of an image that you would see in a typical medical textbook, and it outlining the cerebral vasculature of our brain. We have about 100 billion neurons in our brain, and about every neuron has a capillary. So it's a massive network. And this image really gives you a little bit more of an idea of exactly how dense the brain vasculature is. So what you're seeing here is the blood vessel network of a human brain. Every single vessel is visible, and that happened because a resin has been injected into the blood vessel. So all the brain tissue has been removed. There's no, oh, sorry. Sorry, my slides are hopping. So really, you can just see how densely vascular your brain is. Our brain is about 2% of our total body weight, but it receives about 15 to 20% of our total blood volume. So it's a really, really busy, active part of our body, and it consumes about 20% of our energy requirements. So a very, very busy, hungry organ. And if we think about the blood-brain barrier, it's a wall. You can think about it as a border control. It's not a wall, it's dynamic. It's a living, breathing network that regulates what passes in and out of our blood system. So when we talk about it, the blood-brain barrier disruption, we're thinking about a failure somewhere across this vast system. And when you have a condition like TSC, where tubers are distributed across multiple brain regions, understanding where that failure occurs, why it occurs, are really, really important questions, both scientifically and clinically in the treatment of TSC. But what makes the vasculature of the brain completely unique to the rest of our blood vessels in our body, and why it's so special, can be explained using this slide. So here we can see an outline, a diagram of a normal a blood vessel in our body. So this might be a blood vessel in our muscle or our skin or our gut. And you can see that it has a openings, we call these fenestrations, and essentially this allows the passage of molecules in and out of our blood system, and that's what we want for the rest of our body. However, the brain vessel here looks extremely different, and it's a very different story here. It's surrounded by a whole supporting network of cells and endothelial cells. We see these particular molecules called tight junctions. And essentially what these do is they seal these gaps in our brain blood vessels. And this means they're extremely selective in what they allow pass through from our bloodstream into our neurons and our from the blood essentially to the brain. So it provides this security system of what goes in and out of our brain. And that's really important when we think of infections or any other sort of molecule that we doesn't belong in our brain and we don't want there. So it's very selective and it works around the clock, keeping this homeostasis, so keeping this environment at its optimum. But when that system fails and these tight junctions start to loosen, then we can see, and that's what happens in these damaged cells, and then we can see our brain function changing significantly. And that's what we believe is happening in TSC. So being able to measure the blood-brain barrier is something that's been worked on for a number of years. And these are just images of an MRI. And we use this as a classic tool in neurology all the time. And over on the right, you see a contrast agent called gadolinium. So in the middle panel here, we see a normal MRI brain, this first image, and then the second image where we inject gadolinium, and we see in a normal brain that it's local. The contrast agent is localized to the veins. However, on the other side, you can see the image. This is pre-gadolinium, so this is pre-contrast, and you can see the outline of something that doesn't look normal here. Essentially, when we inject the gadolinium, we can see where the blood-brain barrier is leaking. So here, this is localizing the contrast to the blood-brain barrier. And this is essentially a brain tumor where the blood-brain barrier has broken down and the gadolinium allows us to see the contrast leaking out. So essentially, when we use it for this blood-brain barrier work, we're using a type of MRI imaging called dynamic contrast enhanced MRI. And what this means is that we're using multiple slices, we're summating those images, and it's giving us this gradient where we can see the blood-brain barrier leakage in the brain. It generates this image over time, and we can visualize the blood-brain barrier more effectively. So this is what we would expect to see in a normal brain here on the right-hand side. This is some imaging that I myself and Chris done during my PhD. And here we can see this is a 31-year-old gentleman who was a candidate for epilepsy surgery. So he had drug-resistant epilepsy. He was having at least more than one generalized tonic-clonic seizure per week. And we performed this particular sequencing called dynamic contrast enhanced MRI, really to look at where the blood-brain barrier was happening in his brain. And then this piece of work that was published, we looked at pre and post, so before surgery and after surgery, to see what was the difference between someone's blood-brain barrier while they were actively having seizures and their epilepsy was very active versus after their epilepsy surgery. And in this particular gentleman, he became seizure-free and had a successful epilepsy surgery. And this was his post-op blood-brain barrier imaging. And you can see he pretty much has resolution of his blood-brain barrier dysfunction. So this really kind of provided that concept of the dynamic part of the blood-brain barrier and how it can change over time, and depending on how someone's epilepsy is, how active it is, or what's happening. And I suppose that was a really important concept for us to understand both the before and after picture and how that connects with the epilepsy and its presentation. I'm going to just go slightly off tangent here with the imaging, just really, and it will all tie together at the end, I hope. But I just wanted to give the other side of this, the two major kind of issues or the big problems that we're looking at when we look at this project. So tuberous sclerosis associated neuropsychiatric disorder, an umbrella term to describe the very complex presentation of these five levels of difficulty that people can experience. And I won't go into anything in depth here because I'm sure lots of people are very familiar with this. But essentially, this shows that TAND is not just one thing. It's very layered, multidimensional, and can affect people in different ways at different stages of their life. And again, we do know that the majority of people with TSC have difficulty with TAND at some point in their life. It remains underdiagnosed, we know that, and it's undertreated. And I suppose our part in this puzzle is understanding whether the blood-brain barrier disruption contributes to the severity of TAND. And so, and how this all marries together in how people are presenting to us and living their every day with TSC. This is work done by Chris, and if Chris was here, he will be telling you all about this, and I will try and do it justice. But this is work that Chris and Gary Brennan, who again has worked in this area, looked at the blood-brain barrier of people with different cognitive and mood problems. And essentially, these are three groups. And what we can see is that people who are having difficulty in different areas are showing their blood-brain barrier is just disrupted in different areas. So it's really looking at how dynamic the blood-brain barrier is, how different different areas of their brain are affected, and how the darker areas show a higher concentration of blood-brain barrier disruption. And really this suggests that there's a relationship between where the barrier is leaking and then the types of difficulties patients might experience. And this was the type of work that Chris was kind of bringing to the fore and highlighting to me when we started having these conversations. And I started telling him about the area of TAND and how it affects people and really how difficult it is of an area. And he became very interested having done this type of work in terms of the cognitive presentations and the blood-brain barrier. So again, really important part of this project in terms of how it's all brought together. Again, this is other work, and I won't go into this in any great depth. Again, this is work that Chris has collaborated on, but essentially what this slide is highlighting is how we can use blood-brain barrier imaging to localize lesions in the brain. And again, this is really important in the area of TSC because we have these tubers, we have some of them that are very epileptogenic, that are driving seizures, and others that remain relatively silent in the background. And what this is essentially showing is that by using these blood-brain barrier imaging techniques, we can localize areas in the brain and localize tubers and lesions in the brain. And then myself and Chris, as part again of my PhD, looked at blood-brain barrier in a patient with TSC. And this really was just to provide a proof of concept in whether or not this work was feasible. And so you're seeing images essentially of normal MRI imaging. And then when we inject our gadolinium and do the DICE scan and the blood-brain barrier mapping, we can see that the blood-brain barrier is disrupted in this tuber in a patient with TSC. So really this provided that proof of concept in terms of looking at where the signal is concentrated and how that maps directly to a tuber on the MRI imaging, and whether we can identify these in a wider group of people with tuberous sclerosis. So if we can reliably show that the barrier is disrupted and it co-localizes with the tubers, then we can understand potentially what's driving seizures in those particular tubers, and it possibly become a new tool that we have in terms of diagnosis and treatment in TSC. This is the larger project that we have sought funding for. So there are 6 work packages to this. And your funding and the funding from the TSA allows us to start this process. So this allows us to do the pilot work of this really, really interesting project that not only is addressing a research gap, but potentially has the possibility of addressing a treatment gap once the work is done. So this funding that you have provided to us will allow us to start the imaging on people with TSC, and we'll look to really deeply phenotype those people. We'll be taking a very deep clinical history. We'll be our research participants will be undergoing the DICE imaging. We'll be mapping their blood-brain barrier and identifying tubers, and then measuring their TAND scores also. So this really will go a long way to try and provide this pilot data to hopefully then start looking at the wider parts of this project. So I hope that kind of gives you a whistle stop of what the project is about, and the potential that it can have for TSC into the future. And again, thank you so much for trusting us with your really precious funding. We are really looking forward to the work has already started, you'll be pleased to hear, and we're really looking forward to presenting you with some of the findings once the project is concluded. So I will stop sharing.
Thank you.
My screen.
Thank you, Claire. What an insightful and thought-provoking study that you're doing there. I can already see the questions coming in. So there's a question from Marie and says, have you or will you also be looking at past MRIs of individuals taking part in the project to look at changes in blood-brain barrier over time?
So we won't, and the reason being is that it's a particular sequencing that these MRIs have. That's not to say that in the future we may potentially look at doing more of this particular imaging. So it's not just your regular MRIs that you would have had in the past for surveillance. This is a particular what we call this DICE MRI. But there's nothing to say that we can look at over time doing this imaging again at different intervals, which would be a really interesting question and kind of follow that epilepsy surgery pre and post. So it's definitely in the back of our minds, but it's beyond the scope of this particular project.
Thank you. I can see Carol's got her hand raised, so over to you, Carol.
That's really interesting and fantastic stuff. I really enjoyed that. I just want to get it right in my head, because I feel if I understand something very clearly, I can communicate it. Your big question, why do some brain areas in TS cause epilepsy? So to your proof of concept, the BBB permeability maps to tumours. So it's just that big question, why do some brain areas in TSC cause epilepsy? And we all want to know that as parents, you know, what's shooting off. And it always, I don't know about other people, but my daughter's epilepsy is always different. And the consultant can't get his head around that. You know, he's almost trying to say to me, it isn't epilepsy. And I'm saying it is epilepsy. It's tuberous sclerosis epilepsy. So forgive me for being quite superficial here. That big question then, Why do some brain areas cause epilepsy in TS? You're linking that through all this research to BBB permeability. Is
Correct.
it yes.
So essentially what we're asking is, are those tubers that are particularly epileptogenic or driving these seizures, what does their blood-brain barrier look like? And so because we know with our blood-brain barrier, it can increase inflammation in the area. If a tuber or a part of the brain has a dysfunctional blood-brain barrier, then we can see that it's more excitable. So there's that security system that we have is not intact. And so if we can essentially, what we're exploring is whether this could again be used as a tool to identify that particular tuber's blood-brain barrier is dysfunctional. So that potentially is your culprit.
And so will that lead to therapeutic therapy?
So potentially, and in other areas of blood-brain barrier research, there's a lot of exploration and research going into regenerating the blood-brain barrier. So working on treatments to be able to regenerate or render the blood-brain barrier back intact. And so that could have treatment. That's in other areas, but again, we're really just starting to investigate the blood-brain barrier in TS. But where we differ in TS is we already have a disease-modifying treatment in terms of an mTOR. So molecularly, we're a good bit down the road than we are in other areas of epilepsy. So some of our other disease-resistant epilepsies, we don't have that. So while we're a little bit earlier in the blood-brain barrier work, we're a bit further down the road with TSE and treatment and understanding the molecular pathways.
Fantastic. Thank you.
You're Mary might like to, Mary Vasici is here. She might like to say a word about the project, or I don't
sure.
know.
There's just one more question.
Yes.
Yep, Andrew Jones. So I'm going to hand over to Andrew, and then we can hear from Mary about her experience of getting involved in the project.
Hi, thank you. It's very interesting work. So from your work or the work within blood-brain barrier, pre-existing, excluding TS as well, I assume that with the more permeability of the blood-brain barrier, you have a greater presence of certain molecules, drugs within those patients. So even post-mortem, do you see that a greater amount of molecules which should not pass the blood-brain barrier have gone into patients within so whether that would have an impact on TS as well, that if let's say there are certain drugs which should target specific tubers, if the permeability is increased, then one would assume that those drugs can get into those tubers more easily.
So it can have, so that there are different, I suppose, hypotheses here, and we see that sometimes it can prevent that some of the treatments that we use for epilepsy crossing the blood-brain barrier if it's dysfunctional. But of course, the blood-brain barrier can be the reason why some of those drugs don't penetrate, and we don't see the effect there. But there definitely is. So and again, Chris is our molecular scientist who would be very strong in answering all of these questions. But when we look at some of the research, we can see that there are molecules that should be central that are leaking out, and we can see that in the molecular work that's done. Again, it's a little bit beyond the scope of this pilot project to be looking at the very that kind of molecular work, but that will be in the pipeline, and that is part of that larger project that I described on the slide with the work packages that we hope that we will be able to do a little further down the road. But again, beyond the scope of this particular work.
We have another question from Sylvia.
Hi, thank you so much. Actually, Andrew is my husband. We have little girl who she doesn't qualify for surgery. She has seizures all over the place. I have two questions. So one, are you hoping that in future your screening will help identify those tubules for surgery? Currently, our daughter, she has to have video EEG that they see where it goes from all over the place. So you're hoping that with this quick, hopefully quick MRI, they can check whether those particular seizure tubules are causing epilepsy? Is that the hope?
Yeah, I mean, that is the potential that something like this, that again, it's another tool for identifying those particular tumors. We need to do work on being able to correlate the EEG with the blood-brain barrier imaging to be able to do that very robustly. So that potentially is, and that again was written into our larger project. So that is something that is on our radar also. So definitely a bit away from using it as a clinical exam, quite a bit away. But again, that is a potential use for this.
Thank you. And this image of this 31-year-old who had this surgery and then it improved. I have no idea what I'm looking at, but it seemed all over the brain. And then I imagine surgery is quite localized. So how come it improved all over the brain then?
So brilliant question. So again, it's one of those, it's one of those questions that we have that we need to be able to try and put some of the theory behind. And one of the theories behind that is that that's the seizure spread. So we know when you have a focus, you have that initial misfiring of neurons, but then you get seizure spread. And so that's what we feel that's been observed there. So it may be that then largely the epileptic or the blood-brain barrier is dysfunctional because there are ongoing seizures and this patient's epilepsy was so active.
So that local surgery would have helped whole brain actually.
Yeah. So that blood-brain barrier dysfunction then resolved. But a brilliant observation.
Thank you.
Thank you. And Mary, would you like to quickly say a few words about your involvement as the patient and public involvement lead on this project?
So thank you very much. And I'm delighted Sylvia asked that question because that was the one question I had. And then I had two observations. So it's a huge honor to be part of this study. And I am really, really excited. And then I have one question and one other observation is that I know that the research process is extremely robust when it comes to participation, consent, safeguards, safety, everything is absolutely, it's excellent in where Claire and Chris are carrying out this study. And my question then was, is this just for adults or will it include children? That's a question I hadn't asked before. And the third question then, does somebody have to have epilepsy to be part of this study or can the epilepsy be controlled? And one very last question, how long is the study going to take? And then I'll be quiet.
Okay. So to start the first question, so at the moment, this particular work is adults only. That's not to say that in the future it can't be extended to children, but at the moment for this pilot work, it's adults only. The second question, do you have to have epilepsy? And again, great question, Mary, and one that the research team talked about quite a lot. And so, no, you don't have to have active epilepsy. And again, why is that important? Well, because it will be able to tell us when we compare the brain of someone with tuberous sclerosis versus that does not have active epilepsy versus the brain of someone with tuberous sclerosis that has active epilepsy. What does that tell us and what observations can we make? And the third question, remind me.
How long the study will take?
Oh, hello. So for this particular work, 12 months. So that's our project for our imaging piece is 12 months. So we've started. So we hope by the end of next June that we will be able to present some results to you. The wider project that hopefully we'll get funding for will be a 3 to 4 year project. So that's a bit longer, but we're getting started, which is the important thing.
Thank you. How engaging this session has been. Really pleased to see not just the turnout, but the engagement from the community. Thanks a lot, Claire. We are really grateful for the work you're doing and look forward to seeing how it develops. So thank you, everyone, and we'll make the recording available hopefully by end of the week.
Thanks, everyone. Thank you.
Thank you.